Hi, this is Dr. Dumestri. Thank you for this question. So basically the two types of implants that we currently have are saline implants and smooth, round silicone gummy bear implants. There are a couple textured implants on the market, but I don't personally use those. So when we're looking at saline and silicone, there are some pros and cons for both, but in the mastectomy situation, so this is not a cosmetic implant placement, this is not a cosmetic breast aug. You've removed all of that breast tissue and you only have a thin kind of 1 to 2 centimeter coating or breast envelope to actually cover that implant. In this case, I always recommend using silicone gummy bear implants instead of using saline implants. And the reason for that is that when they're only under that thin covering, we already have issues with implant show, meaning rippling. When you hold the implant, you see it has these little folds on it, and those folds actually come through the skin as ripples. In the saline implant, those ripples are a lot worse because the substance that's filling the implant is full liquid, and you'll see here, you can see when you're shaking the implant that saline has a lot of jiggle to it. It's like a water balloon. So when you just put it there and you lightly shake, it has a ton of motion. Whereas the silicone implants, they're now all gummy bear implants, meaning they're form stable. So if you cut into them, it's actually a solid substance. It's not a liquid gel. So when you see the shake for the silicone implants, they don't move nearly as much as the saline ones. And people report if they do get a saline breast implant reconstruction, they really feel like they're walking around with a couple water balloons. The rippling's a lot worse and they don't feel nearly as squishy and soft. For the cosmetic patient population, when you have a thick breast gland on top, really you can go either way. They're gonna feel fairly similar, although again, people report, especially thin patients with not very much breast tissue, preferring their gummy bear implants. Yeah, hope that helps and have a great day.